Imagine a tiny organism in your stomach causing your eye problems. It might sound far-fetched, but the reality is that the human body is a complex web of connections, where even the smallest imbalance can have surprising effects. The gut, often called our second brain, is home to trillions of bacteria that play a crucial role in our overall health. When something goes wrong in this delicate ecosystem, the consequences can reach far beyond just stomach aches or digestive discomfort. Our bodies are interconnected. What happens in one part can affect another. The gut communicates with the rest of the body through nerves, hormones, and the immune system. This means that a problem in your digestive tract can send signals to distant organs, including your eyes, sometimes in ways we're only beginning to understand. The gut-eye connection is a growing area of research, revealing how stomach issues can lead to eye inflammation. Inflammation is the key. When the gut is irritated or infected, it can trigger an immune response that doesn't stay contained. Instead, this response can travel through the bloodstream, reaching sensitive tissues like those in the eyes and causing redness, pain, or even vision changes. When your body fights an infection, it can trigger a system-wide response, affecting sensitive areas like the eyes. The immune system, always on alert, sometimes overreacts, leading to inflammation in places you wouldn't expect. This is why people with chronic gut conditions, such as Crohn's disease or ulcerative colitis, often report eye problems as well. Your immune system, like a city's police force, responds to trouble in the stomach, impacting other areas, including the eyes. Just as police might respond to a disturbance in one neighborhood but end up affecting the whole city, your immune cells can create a ripple effect throughout your body, sometimes causing more harm than good if the response is too strong or misdirected. This gut-eye axis changes how we approach health. Doctors and researchers are now looking at the body as an integrated system rather than isolated parts. Understanding these connections helps us find better ways to diagnose and treat mysterious symptoms that don't seem to have a clear cause. Unexplained eye symptoms might require looking into the digestive system for answers. So next time you experience eye discomfort, remember, it could be more than just a gut feeling. Your body's hidden connections might be telling you something important about your overall health. Meet Helicobacter pylori, or H. pylori, a remarkable and resilient bacterium that has evolved to thrive in one of the harshest environments in the human body, the acidic depths of your stomach. Unlike most bacteria, which are quickly destroyed by stomach acid, H. pylori has developed unique adaptations that allow it to survive and even flourish where few others can. In fact, this microscopic organism is astonishingly common, infecting about half of the world's population. No matter where you live, your age, or your background, you could be carrying this hidden guest without even knowing it. Its presence is truly global, affecting people from all walks of life. For many people, H. pylori remains silent, causing no obvious symptoms and living in peaceful coexistence with its host. However, for others, this bacterium can be a source of persistent digestive troubles, ranging from mild discomfort and bloating to more severe pain and nausea, especially after meals. The real danger begins when H. pylori burrows deep into the protective lining of the stomach. Here, it triggers chronic inflammation, gradually wearing down the stomach's defenses. Over time, this can lead to the development of painful ulcers, open sores that form on the stomach wall and can cause significant discomfort and complications if left untreated. Your immune system recognizes the threat and launches an attack, sending immune cells to the site of infection. But H. pylori is a master of evasion, cleverly hiding from the immune response and persisting for years. This ongoing battle leads to continuous inflammation, which can silently damage the stomach over time. What's more, this inflammation isn't always limited to the stomach. In some cases, the effects can become systemic, spreading throughout the body and contributing to a range of health problems that extend far beyond the digestive system. Research has linked H. pylori infection to unexpected issues like skin rashes, cardiovascular complications, and even certain eye conditions. Its impact is far-reaching, making it a concern not just for your gut, but for your overall health. The stomach, once thought to be just a site for digestion, becomes ground zero for inflammation and disease. This unseen tenant, H. pylori, is more than just a silent passenger. It's a potential threat that can shape your health in ways you might never expect. How does stomach inflammation reach the eyes? The pathway is direct. H. pylori infection releases inflammatory messengers into the bloodstream, like emergency vehicles alerting tissues. The eyes, with their delicate blood vessels, are vulnerable to these inflammatory molecules. Molecular mimicry can cause antibodies to mistakenly attack healthy eye cells, leading to inflammation. This combination of factors compromises the blood-ocular barrier, allowing inflammation to affect the eyes. H. pylori is a bacterium most commonly associated with stomach ulcers, but its effects can extend far beyond the digestive system. Recent research has shown that the chronic, low-grade inflammation caused by H. pylori infection may have a significant impact on eye health as well. This systemic inflammation is now being linked to a range of specific eye conditions, highlighting the importance of recognizing and treating H. pylori not just for gastrointestinal health, but for overall well-being, including vision. One such condition is central serous chorioretinopathy, or CSCR. In CSCR, fluid accumulates beneath the retina, leading to symptoms like blurry or distorted vision, and sometimes even a dark spot in the center of your sight. This can affect daily activities such as reading or driving, and is now thought to be more common in people with H. pylori infection. Another eye condition linked to H. pylori is uveitis, which is inflammation of the eye's middle layer. Uveitis can cause eye pain, redness, light sensitivity, and even vision loss if left untreated. The connection between H. pylori and uveitis suggests that treating the underlying infection may help reduce the risk or severity of this potentially serious eye problem. Blepharitis, or inflammation of the eyelids, is another condition that has been frequently associated with H. pylori. People with blepharitis often experience red, swollen, or itchy eyelids, and sometimes crusting at the base of the eyelashes. Encouragingly, studies have shown that treating H. pylori can lead to significant improvement in blepharitis symptoms. There is also growing evidence that H. pylori infection may play a role in the development or worsening of glaucoma, a condition characterized by increased pressure in the eye that can lead to vision loss. By contributing to systemic inflammation, H. pylori could potentially exacerbate glaucoma, making early detection and treatment of the infection even more important for protecting your vision. Be aware of eye symptoms linked to H. pylori, especially if you have digestive issues. Blurred vision, light sensitivity, and persistent redness could signal inflammation. Eyelid issues like redness, itchiness, and crusty deposits may indicate blepharitis. These symptoms might be your body's warning system, indicating systemic inflammation. Document symptoms and consult both a gastroenterologist and an eye doctor for comprehensive care. Treating H. pylori can significantly improve eye symptoms. Standard treatment involves antibiotics and acid-reducing medication to eradicate the bacteria. Once inflammation subsides, the body can heal and eye conditions may improve. Patients with CSCR often see fluid reabsorption and vision restoration. Uveitis and blepharitis symptoms can decrease, reducing the need for long-term treatments. Recovery involves more than antibiotics. It requires a comprehensive approach. Complete the full H. pylori treatment as prescribed to ensure eradication. Support healing with an anti-inflammatory diet, rich in fruits, vegetables, and healthy fats. Stay hydrated and schedule regular eye checkups to monitor progress. View symptoms as signals of deeper imbalances and embrace a holistic view of health for a resilient future.